Vaccines have saved more than 150 million lives over the last 50 years, but persistent and emerging challenges threaten these significant public health gains. The global share of 1-year-olds vaccinated against diphtheria, pertussis, and tetanus has dropped in recent years, for example. Vaccine hesitancy can spike with new policies, procedures, information, and perceived risks. The COVID-19 pandemic showed hesitancy can also be influenced by government responses, populism, and vaccine nationalism. Introducing vaccines during outbreaks or among marginalized populations can also impact uptake. Context-specific knowledge and learning can help tackle this complex problem. That is why the Alliance has started a multi-year program to support studies across 6 countries examining how best to reach zero-dose and under-immunized children and how to address adolescent and adult vaccination. Health policy and systems research has many roles to play in enhancing vaccine uptake. Experts from around the world gathered to highlight how the field can address the complex issue. Considering community-led strategies.
We need to understand what the key barriers are in the specific communities, and it may vary from community to community. So we first of all have to start with understanding in this community what are the key issues. In what community might be the fact that they are so far away from the next health center and they have to walk 30 kilometers or they have to drive 30 kilometers to get to the next facility, which we have seen in some of our studies in Zambia. In another community, it might be the fact that it's a riverine community and, riverine transport is very difficult. So every community is different.
We are moving away from times where experts are the only people that know stuff. Communities know stuff. They carry a lot of tacit knowledge within their traditions, long-term traditions that have been created for a long time, cultures that move and transcend across times. So we want to work with that.
Applying different research and learning approaches.
Systems thinking has the unique capability of crossing different sectors and disciplines and bringing stakeholders together and understanding what is a common goal and then trying to investigate what are reasons for deviating from reaching that goal. So systems thinking really enables you to look into the different sides of a system on the different levels using background from all kinds of disciplines and also qualitative and quantitative information.
Focusing on national level policy problems.
While vaccination coverage is considered the health indicator or something within the exclusive preserve of ministries of health, it is influenced by many things: finance, the social determinants of health, there's education and all of that. There is culture, there is tradition. So it's important to make sure that all of those sectors, we find the best evidence for how to incorporate the actions that are required by all of those sectors to improve vaccination coverage.
We have to see on the policy issues of the government in different regions. That must be one of the questions, because there is many discrepancies between government to government while the vaccine is the same. The entire world, they're taking the same vaccine, but the policies are different.
Exploring new opportunities and challenges.
How can we use the education sector to ensure that the health workers that are being churned into the health system understand the science behind vaccine, understand vaccine safety, so they can be the ambassadors of making sure that our communities receive it well and that we can see the uptake that we are seeing. So how can we revise curriculums to speak to that?
Thinking about global influences.
I think we really need to think about what are the global health norms that underpin these forces. And from there, really think about what is the intersection and interaction of different global health policy actors that reinforce these norms. So, for example, if we're talking about vaccine uptake, we're very much looking at subsidy-based approaches to vaccine uptake or material power. And that means actors that have the most material power are able to then set the global health policy agenda.
Improving vaccine uptake is a multifaceted challenge that requires a holistic approach. From understanding and integrating community perspectives to leveraging evidence-based research and innovative systems thinking, Health policy and systems research can help tackle this complex problem.